I'm a different kind of doctor. I have spent my career, 25 years, being a prevention medicine guy. I've been thinking about populations' health as a whole for a long time. I was the first physician to lead the national YMCA's health agenda. So, 2,700 facilities, 10,000 staff across the country were working to prevent diabetes, to make sure that cancer survivors were getting through their treatments well and that their mental health was taken care of. I had 55,000 cancer survivors in 1 year go through a program I helped create at the Y called Live Strong at the YMCA, for example. So back then, when I was in that role, I often said that I had 22 million patients. There are 22 million members of YMCAs across the country. Now in Michigan, I'm fortunate enough and have the privilege enough to not just represent the 40th House District, but to be in a place where I can serve the health of 10 million Michiganders. And so I take that responsibility seriously, and I focus very much so on health and healthcare issues in Lansing. The truth is, when we look at our healthcare system right now, it's on fire. And not a lot of folks recognize just how fragile it is at this moment. I talk a lot about the cost of healthcare. We now have a healthcare system that is costing $4.3 trillion a year at the national level. That's almost 20% of our GDP. So if we want to fund schools or public safety or community college reimbursements and scholarships or child care initiatives, school breakfasts, and we're wondering where all the money went, increasingly it's in healthcare. We're spending too much for our health care. It ends up being almost $14,000, $15,000 for every man, woman, and child in Michigan per year, whether they're paying for that health care out of pocket, whether their employer is paying for that health care through employer-sponsored insurance, or whether we as taxpayers are paying that amount for everyone who's on Medicare or Medicaid or dually enrolled in both of those programs. The cost of health care is just growing at an unconscionable rate, almost 10% per year, and none of us are getting 10% raises every year. So we're all falling behind. And that's just the cost piece. The other problem is that we're not getting what we're paying for. We pay more than any other country in the world for per capita health care, and we aren't seeing the results of that expenditure. We aren't the healthiest society on the planet. We're kind of middle of the pack at best. And medical errors are a significant cause of cost overruns. Our quality of care could really be improved. The other thing that I talk about related to the healthcare situation that we have right now is just how fragile our healthcare workforce is. Since COVID, we've had about a 24% turnover in our healthcare workforce. And that's in the context of shortages in primary care. We're expecting to have tens of thousands, 30, 40,000 fewer primary care providers than we need in this country by 2034. So when I go to Lansing, I talk about these things all the time: healthcare cost, healthcare quality, the importance of focusing on our healthcare workforce, and above all else, making sure that we put patients at the center of our healthcare system and of our policy making when we address healthcare policy in Lansing. The situation that we're faced with in the United States healthcare system is that at the national level, it's in trouble, and it's getting even dicier. With the budget cuts that are being proposed, amended, changed on a daily basis, there's an incredible amount of uncertainty in what our healthcare system will be facing and what patients can expect from their healthcare system. There's a debate about cutting up to $880 billion right now out of our Medicaid budget. And that would be devastating to millions of Americans and almost 1 million Michiganders who are expected to lose access to health care if those cuts come through. And that's important context when you think about what can states do. Because states are going to be the front line of responding to these holes that are being created by the Trump administration and the Republican Congress in DC. States, quite frankly, don't have enough resources to backfill the cuts that are coming. In Michigan, we have a $83 billion a year budget. 40% of that is federal dollars that come through the state and end up being in federal programs that are state administered. Medicaid is the biggest program there. And when you look across the country to see which states are handling challenges the best, Michigan is not really necessarily among them. Other states that I would point to that have done really innovative work to put people at the center of healthcare include Oregon, New York, North Carolina, a number of other states that have, not through legislation, but just through departmental actions and seeking waivers, designed their healthcare systems differently to prevent illness, to reduce low-value care, to improve the quality of care, to stabilize their healthcare workforce, to integrate with community-based organizations for the greater good of a community. And we still have that opportunity in Michigan. The truth is that the cuts that we're faced with are going to require everyone to be at the table. Patients are being asked to put skin in the game in these Republican-led proposals in Washington, D.C., where new co-pay requirements might be required. Folks who are on Medicaid may have to go through a redetermination process every 6 months to document that nothing has changed for them in their household finances that would make them ineligible for benefits that they've received for many, many years in many cases, whether those are moms or older adults or veterans, folks with behavioral health needs. Medicaid is a lifeline for 2.6 million Michiganders, over 1 million Michigan children. 45% of all live births in the state of Michigan are under the Medicaid program, almost 50%. So when we look at the scale of the cuts that are coming from Washington, D.C., that our congressman here in Southwest Michigan is supporting, I can see down the road, we can all see down the road that there's going to be a great deal of pain. And it's not just that patients are going to be on the hook. We are all going to be on the hook because Medicaid is such an important building block of our healthcare system. I like to talk about our healthcare system as almost a house of cards. You would never design a system like the one that we have. We've grown into this one. And Medicaid is a foundational block in this house of cards. If it's removed the way that it's being proposed, rural health centers will shut down. FQHCs, safety net providers, will not be able to balance their books. So it won't only impact people who are enrolled in Medicaid. All of our healthcare costs are going to go up because folks who don't get care, who don't get insurance, will still get care. No physician, no healthcare system in the state, by law, would turn away a pregnant mom who shows up in the emergency department going into labor. No emergency department in the city or state would turn away someone who was at risk of harming themselves or others, or had a medical emergency who was, had their vital signs that weren't stable, they were losing blood or they couldn't breathe. Emergency care is a requirement in this state. So if we cut people off of insurance and cut them off of things like preventive care benefits, it doesn't mean we aren't going to pay for it. It just means we're going to pay more later. So patients need to play a role in this. Healthcare systems will inevitably play a role in this. But even drug companies and insurers and physicians and other healthcare providers, the size and scale of the cuts that are being debated are going to mean that all of us feel it. And we should all be at the table or we'll be on the table. As healthcare costs are increasing 10% per year, the fastest growing segment of the healthcare dollar is related to pharmaceutical drug prices. In 2022, all the drugs that were approved by the Federal Drug Administration for their first use averaged a cost of $233,000 per patient per year. In 2023, 1 year later, the average cost of each drug approved by the FDA for its first use was over $300,000. That was a 25–30% increase year over year in pharmaceutical costs. In 2022, actuaries in the state health department were planning to issue new contracts to managed Medicaid insurers to, on behalf of all Michiganders, manage the health care of the 2.6 million Michiganders who get Medicaid as their primary insurance. And they projected out the cost for 2024. It turns out their projections were wrong by about 250 million. And 240 million of that in 2024 can be ascribed entirely to a new, incredible new class of drugs, GLP-1s. These are incredible medications, but at the cost that they are being offered and at which the state is paying them, we can't afford it. So what states can do, as about a half dozen have begun doing, are establishing things like prescription drug affordability boards. Back in 2000, when Medicare Part D was passed, there was a prohibition from any government agency negotiating for drug prices with drug companies. When drug companies, like Pfizer, who's in my district and we're so proud of for having vaccinated the world, they set their prices. And we in Michigan pay 300% more for drugs than folks across the Ambassador Bridge, right, in Canada. These prices are often predatory and based on their need to provide stakeholder or shareholder value. But we as a state should negotiate for better value for Michiganders. And creating a board like a prescription drug affordability board isn't a quick fix. It's not a silver bullet. It's not going to by itself immediately lower drug prices. But what it will do is establish a process by which scientists, economists, folks who have knowledge of the drug industry but who have never been employed by or owned any slice of a drug company, who are not lobbyists, get a chance to look at the return on investment that Michiganders are getting from paying for our medications and help, in some cases, when it's deemed by that board that we're paying too much, they can set an upper payment limit. In the states that have put this kind of policy in place so far, it's taken a couple years before they've gotten to the place where they've started identifying some drugs that people in Colorado are paying too much for example. And so they're just starting to go through this process, and it's survived a couple lawsuits. Again, I'm not promising this is going to be a quick fix, but we need to put the drug companies on notice. We need to put drug companies on notice to say that we're watching. And when we're negotiating for the health and wellness of 2.6 million Michiganders in the Medicaid program, that we want better value. Prevention is our way out. I wholeheartedly believe this. We are spending too much for low-value care in our country and in Michigan. And as these cuts that are being debated in Washington flow downhill and start impacting health systems and patients and providers, there will be an important switch, I hope, towards more preventive measures. President Trump and Secretary Kennedy often talk about these things under the umbrella of Make America Healthy Again. And I love what my colleague, Dr. Abdul El Sayed, has said, that sometimes these folks say the right things, but for the wrong reasons. And in my case, I wholeheartedly believe that we need to make sure that the value that is inherent in our communities in producing health is connected to our healthcare system. When I was at the YMCA, the National Health Officer and Vice President of all the YMCAs in the country, we had a program called the Diabetes Prevention Program. And we showed that community health workers, people who work at the YMCA, could produce better health outcomes at lower costs than the more formal healthcare system. We could keep people off medications. We could reduce number of days in the hospital. We could reduce number of emergency department visits. We could reduce low-value care by investing in the community. And I think that that's one of the ways that we're going to get through this, is by shifting from a volume-based healthcare system that's focused on treatment to a value-based system that only reimburses providers fully when they've taken preventive measures into account and are producing great health outcomes for patients in their care. States like New York or Oregon or North Carolina that I've mentioned previously might be serving as models are doing just that. They have regional hubs that are set up to coordinate care through pantries and housing assistance, violence prevention, utility assistance. Folks who are on Medicaid end up needing supports to get through the day, not just to get their health care. And it turns out that if you're trying to help someone who's on Medicaid achieve better health, you can also achieve better value for taxpayers by making sure that they have shelter, that they have refrigerators to store their insulin, that they have the ability to practice good health. And so I think the answer is going to, in large part, be that we have to invest upstream in preventive medicine and invest in our communities, the social fabric that can keep people healthy and keep them out of health care before they start spending dollars that could be avoided in the first place. It's a rebalancing. It's a rebalancing that we have to do. Right now, 95% of our health care dollars are spent on the treatment side, and 2 or 3% actually are spent on the prevention side. So we're just paying too often too much for the wrong things. And there are too many profit motives in healthcare, whether it's up and down the supply chain on pharmaceuticals, whether it's up and down the supply chain when it comes to labor and the cost of care delivery. We need to be more efficient. But the way that we can be more efficient is not by cutting jobs that provide essential services. It's by investing dollars in upstream preventive measures where the community finds value and offers value. We can keep people out of the hospital and out of emergency departments by making sure that they have access to food and housing. And those are smart investments for the Medicaid program and for taxpayers. Older adults are at a particular risk from the cuts that are being debated in Washington. When people hear Medicaid, they think it's something different than Medicare and that it's maybe not focused on the older adult population. But 65% of long-term care in the state is covered by Medicaid. So whether you're an older adult or you just love one and you're thinking about long-term care needs, I'm so fortunate I have an 87-year-old healthy mom. But my dad, before he passed, was having signs and symptoms of dementia. And for those of us in that bucket who worry about our older adults in our lives and how we're going to care for them, it's a big undertaking. It's almost $100,000 a year on average for long-term care for older adults, and 65% of that is covered by Medicaid in the state of Michigan. So these cuts that are being talked about with big numbers, $880 billion of cuts to Medicaid, people can easily say, oh, that's not me. But it's going to affect 65% of our dollars in long-term care in this state. So moms and dads and mothers-in-law and fathers-in-law are going to be moving back home. Yeah, well, actually, it's not only people's health care stories that move me in the way that I intend to serve the 40th House District. For me, a lot of things are health-related. When you're trained as a hammer, the whole world is a nail, right? So I see the health consequences of not providing our K through 12 students with school lunches. I know that when mom and dad have to plan to go to the grocery store 2 or 3 more times a week and afford the groceries that are going to go into packing school lunches for their kids, that there's real economic impact there, but it's also the mental health of it, the stress of those costs being pushed down to parents, the worries that I have and that we should all have about how many kids will just go hungry from cutting programs like school lunch. And so when I hear families tell me about what they're hearing in the media about cuts to things like school lunch or child care, I still think in terms of health. I think about the fact that those kids who are hungry not only aren't going to learn in schools, hungry kids can't learn, right? Not as well as kids who are fed. But those kids aren't going to have the same literacy, the same health literacy that other kids will when they get older, and will help them live healthier lives. If you are hungry, if your parents are food insecure, and what happens is parents always choose quantity over quality. If you don't know where your next meal is coming from, those are the choices you make. You know, when I was a medical student, I was a single parent, and I don't know that I could have gotten through medical school without programs like WIC, without programs like tuition assistance. You know, these are all programs that are on the chopping block. And I happen to see them as health-related programs. It's a useful frame for me. I really believe that we will see health outcomes from these cuts that will affect all of us. But those stories that I hear about school lunch, about someone's inability to keep their business afloat because the cost of health insurance for their employees is skyrocketing, that they can't afford the drugs in the health insurance plans that they purchase for their employees. All those kinds of stories, they all move me. And I'm so privileged to be able to represent the 40th House District, to be the only doctor in the House or the Senate. You know, I feel incredibly lucky and blessed to be in the role that I am, and I wake up every morning wondering what the day will bring. There's a lot of mysteries in Lansing these days, but completely committed to improving the health and quality of life of everyone in the district. You know, if I could reframe a lot of the conversation that we've been having, you know, I would say that, you know, again, these numbers sound huge. They're incomprehensible, the size of the cuts that we're facing, but they have daily impacts on people's lives. I'll give you one example. When moms in Kalamazoo County are applying for or need temporary assistance, because we've been concerned about waste, fraud, and abuse, they have to, by law, document paternity and see if there are someone else who's responsible for the finances of their kids before the state puts resources in to help that mom and that family go through, just get through life. But the cuts that we've seen to federal programs and things like that now mean that we don't even have the staff to manage that waste, fraud, and abuse program. So there are 50 moms right now in Kalamazoo County who can't get the services they need because the cuts that have happened already this year are resulting in people not getting the services they need. And that plays out in every clinic. I'm on faculty at the Western Michigan's med school here in Kalamazoo at the Homer Stryker Medical School. And the care that we try and provide for folks, you know, we see it every day when patients show up and they're food insecure, when they don't know they don't have a place to store their insulin, they don't know where their next meal is coming from. You know, I help med students understand that they have to see the whole person. And whether it's on street medicine rounds, taking ointments and lotions and over-the-counter medicines to people who are homeless, or whether it's in substance misuse clinics or responses that we see at the library. You know, at the library, they're giving Narcan injections every week in Kalamazoo Public Library because of the social drivers of health that we all see in our community. You know, these are all human stories. And, you know, again, for me, when I think about just the people closest to me, my son who's here in town, you know, who is a veteran, who doesn't know entirely where his health benefits are going to come from if these cuts come down. Or when I think about my mom, who many people know in this community, who was a gym teacher to half the community for 40 years, I think about what her long-term care needs are going to be. And these huge cuts that are coming for all of us are going to have a human toll on all of our families, on all of our neighbors. And I think we're all going to not just have skin in the game, but we're going to all have to be a part of the solution. Yeah, so, you know, I've had about 4 months in my new office in Lansing. I have a great team, and we hear from constituents from across the district every day. I have monthly coffee hours rotating around the city of Portage, Oshtemo Township, Texas Township. I have office hours that are more like happy hours rotating around the district. I have daily correspondence and meetings in Lansing with constituents. And I hope people will look to our office as a resource to solve problems that they need. So please contact my office if there's anything that I can help you with. You can find information at the State House of Representatives website for my office, or you can email my office at mattlongjohn@house.mi.gov. So, this is my community. Depending on whether you're looking at my mom's side or my dad's side of the family, I'm a fifth sixth generation member of this community. The Longjohn name, most people on the north side of Kalamazoo remember it as part of the Longjohn florists. That's where dad's side of the family was. They were celery farmers. Mom's side of the family comes from Vicksburg. So this is my community. I grew up here, went to Portage schools, went to Kalamazoo College undergrad. My kids, grew up here. So when I am doing this job that I have in Lansing, it's so often the case that something will come up and I'll be like, I know exactly who I have to call about that. It might be a Republican county commissioner that I've played golf with, growing up. It might be the owner of a restaurant that, I might need to connect somebody to. It might be the sheriff who I called this morning after huge storms last night. As a product of this community, as someone who lives and breathes in this community, I'm just so lucky and privileged to serve here. And a fun fact about me, I guess that's community-based, is that I've spent more time than I should collecting comics and being a client of Fanfare since I was riding my bike there in middle school. That was a conversation we had before I got started. I'm not sure what else I would add.